Can an outpatient exercise program for pregnancy-related pelvic girdle pain improve pain and function versus education? A feasibility study. This study was conducted while the first 3 authors were students at Columbia University Irving Medical Center. We have since graduated in 2019. Overview and purpose. The purpose of this pilot study was to determine the feasibility of women with pregnancy-related pelvic girdle pain, or PRPGP, to participate in an individualized exercise program to improve deep core activation and coordination throughout the pregnancy and postpartum periods. There is currently conflicting and inconclusive evidence for exercise interventions in PRPGP. Recruitment methods. We recruited women from an urban medical center and asked women who were pregnant with self-reported pain to complete a screening questionnaire, which included the pelvic girdle questionnaire, or PGQ, and a pain location diagram. Women who met the inclusion criteria participated in a screening phone call, and then those who still qualified were invited for an on-site initial physical evaluation to confirm the diagnosis of PRPGP. Women were then enrolled in the study and randomized a priori into exercise alone and exercise and education groups. Education included information about movement, posture, and biomechanics, while the exercise and education group had an individualized exercise program targeting key musculature that was progressed as tolerated. Participants in the exercise and education group were asked to come on site for follow-up visits, while phone call follow-ups were conducted at the same intervals for the education alone group. Results. For our results, there was a significant decrease in current pain and pain at worst levels in both groups. Statistics also revealed a significant improvement in PGQ scores in both groups.
Interpretation of the results is limited due to the lack of a true control group. Participants in both groups received education, and the EE group also received exercise interventions. Women in this study were diagnosed with PRPGP, and it was considered unethical to have a group that did not receive any intervention. Educational information as an intervention is regarded as a minimum of care for this population, and was therefore provided to both groups. Recruitment for this study was challenging, and as a result, there was a small sample size. Women who are pregnant have substantial time commitments with OBGYN visits on top of their other responsibilities. While recruiting women from the OBGYN department at CUIMC, many were commuting from considerable distances, which limited the availability of many women contacted to return for follow-up visits for the study at the medical campus. Participants reported that travel was the primary reason for declining to participate in the study. Future research should consider time and travel commitments, as future studies may have greater feasibility if conducted in or close to a participant's home or via a telehealth platform to help facilitate improved adherence.
Women with PRPGP exhibited improvements in pain and function regardless of whether they received education alone or exercises and education. It is important to know for MDs that they can refer their patients to PT for exercises or even education only. Education alone was found to have a significant impact on the pain and function of participants. This highlights the importance of women with PRPGP receiving information about movement, posture, and biomechanics. Although education is established as the minimum standard of care, it has not been executed in practice. Information and support can be easily provided for this population either in person or virtually, and therefore, as clinicians, we should ensure that we are providing educational interventions for all PRPGP patients. With the current COVID-19 pandemic causing increased difficulty for people to leave their homes and travel to a medical facility, it is also important for patients to know that telehealth is a viable option for them to still receive educational care during this time. The exercise intervention provided in this study was easy to perform at home for the participants. Only one participant reported that adhering to the prescribed exercise protocol as part of their home exercise program was problematic. Overall, the patients in the EE group reported that the exercises were beneficial and easy to perform independently.